But let's say that I had open heart surgery. I don't think I would be capable after that surgery to do what I'm doing right now. I think that would have been an impediment to my health, and I think I would have had a decline instead of an escalation in the way that I feel.
Usually I'll say you're not going to die anytime soon, and it won't be of heart disease, period.
Yeah.
Right? Not on my watch.
Really, you had mentioned to me it's something about siblings being more alike.
Well, right. So, on a genetic basis, right?
Yeah.
So having a parent with heart disease certainly increases your risk, right?
Yeah.
Makes sense.
Yeah.
Having two really increases it. However,
Yeah.
and this is important, genetically, the greatest risk that you will have a cardiovascular event is not mom or dad, it's a sibling. So if you're in a family and one of your siblings has a stroke, a heart attack, gets stents or balloons or bypass surgery, that is, has plaque, that is the greatest, highest genetic risk factor.
Yeah.
Because you are more like your siblings genetically than you are mom or dad. You're only half like dad, half like mom.
Yeah.
But you are most genetically like your siblings. So
makes perfect
if
sense.
you have a sibling who has had an event, please
Call us
call
immediately.
911.
Yeah, exactly. Call
www.clearcardio.com
Yeah, exactly.
right now.
Yeah, exactly.
Operators are standing by. No, I mean it's fairly fascinating.
kidding
Obviously,
aside, but
mom and dad, right,
Yeah.
is certainly puts you at high risk. But if you have a sibling, you better really watch out.
Yeah. There's a percentage of folks that just in the fact of having a heart catheterization, never mind the stents, which I understand you have to have blood thinners for a year, which can, if you have cuts, bleeding issues, but just having a heart catheterization can actually cause heart attacks and strokes. Is that right?
Absolutely.
Yeah. So there you have it. So you've had two of those, right? And so luckily you didn't have any major complications, right?
Yeah.
So you were fortunate. But so you're thinking about these surgeries and you're going, I don't want those types of like long-term complications.
Right.
Especially, how would you even have a cadaver? I don't even understand that. I mean, we don't have to go down that rabbit hole. I'm just thinking.
The first I heard about that.
Don't you have rejection issues? Then you have to start taking medications.
Well, no, they're chemically treated, so they're like
they
leather.
sterilize them. Or
yeah,
something?
they're like leather, right?
Okay.
But the problem is we don't use them because they just don't work.
Fair
They
enough.
immediately just fail. And
Wow.
It's just you don't go.
That's
there.
good to know.
Yeah.
It's good to know that I didn't go forward on that.
Yeah,
Yeah.
don't worry. There's no
No.
zombie going into you right now. So, okay, so you hear all of this, and you're thinking, okay, I've got some light at the end of the tunnel.
And it's not a
You
train.
survive, because a lot of people don't actually come out on the other side. You were fortunate you didn't end up having all that surgeries and all those things,
Right.
complications.
During my interview with Dr. Osborne, we started going down a completely different track. I felt comfortable. I was very comfortable with his knowledge. He and again, nobody knows me better than me, and I knew that course of open heart surgery and all that it entails was not the way I needed to go. Because I knew that I wasn't going to die in 3 months like they were telling me that I was.
Yeah.
So we started. We did some medicine changes, and by the way, the medicine. I'm 67 years old. I take
Oh wow, you look
rosuvastatin.
fantastic for 67.
Thank you.
I had no idea.
Yep.
Wow.
Rosuvastatin and a drug called Nexlizet.
Okay. What are those drugs?
That compound has has changed things dramatically.
Okay.
And that compound also does nothing to my psyche, my abilities. It's just something that works within my body.
Okay, so well tolerated. What do these drugs do? These medications?
Yeah, so all of the medicines ultimately lower LDL, if you want to be really sophisticated. ApoB, we'll have to talk about that one of these days. But they all lower LDL. It's not the blockages that get you. In fact, in the world of cardiology, and unfortunately you're a great illustration of this, but on the good side of things, in the world of cardiology, we have been ballooning and stenting and bypassing like crazy, to the point where the sofas and the chairs in our waiting rooms are ripped and torn, and right? I mean,
Right.
thousands and hundreds of thousands, millions of people have gone through the cattle chute
What a visual.
as we ballooned and stented and bypassed, and none of that made people live longer or prevented the event, because we were treating the wrong aspect of the disease. It's not the blockages. What actually does predict mortality and heart attacks is actually total plaque volume, right?
You treat the symptom. People,
Right.
historically, the symptoms have been treated and not the cause.
Precisely, right? We're about, we'll detect all of this stuff, and I'm not anti-stent. If you have bad symptoms that I can't fix with medications, then fine. I mean, it's the knee replacement of cardiology, right? I mean, no one should be limited. But with excellent medical therapy, we have great drugs that will treat angina, by the way. Very, very, very few people, and JD, as the layperson could testify to this, of all of the people now, which are a lot, that we've treated in ClearCardio, how many have needed balloon stents or bypass surgery?
Not a single one.
Exactly.
Not one.
Right? And not to say they don't have disease and plaque and blockages.
We've seen lots of disease
but
and plaque.
none of them have needed what we call revascularization, balloon stents and bypass
Hundreds
surgery.
and hundreds of
Right?
patients.
Yeah. Because we're really treating the root cause, not the symptoms. Now, if you have symptoms, we'll take care of that. But even with some of the medications we have, I actually call them oral stents because they work so well to relieve angina that you could take a couple pills that are generic and get the same result as a $50,000 piece of steel in your left anterior descending coronary artery.
Yeah,
Most
then you
people
have to
say,
take blood
I'll
thinners
take the
and-
pills.
Yeah.
And then blood thinners, risk of complications, heart attack, strokes, kidney failure, infection, bleeding around the time of the procedure. And then if you stop the blood thinning medications that keep that stent open, if you do, and I've seen it happen, that stent could immediately clot off. The mortality rate is 45%.
Well, we have soft plaque in our heart. We want that soft plaque to become completely stagnant. We want it hardened. We don't want it
yep.
moving. Yes.
Yep.
So and eliminate the soft plaque. That hard stuff is exactly where it needs to be.
Yep.
Hard, not
Yep.
moving.
Yep.
And we take care of what is moving.
It's
the lava.
cured,
It's
right?
cured.
You're a builder, right? It's cured.
It's cured. It's
Right? It's
built.
not going
All the
anywhere.
bricks are on that wall.
Exactly.
Yeah.
The other thing, another message, and unfortunately this happens again and again, so I'll caution the audience too. Somebody gets a calcium score. Okay, it's a non-zero number, right? There's usually some degree of panic, blah, blah, blah. Maybe get referred to cardiology or whatever. Things can happen. Get a stress test, which is kind of worthless, frankly, or whatever. So they get a calcium score, things happen, and then down the road, a year, 2, 3 years, whatever, down the road, they repeat the calcium score. That is the wrong answer, right? Once you have a positive calcium score, you got plaque. Done. Not risk, not could be, maybe possibly, you got plaque. The next step should be cardiac CT with AI, basically clearly, right? Because then we can understand how much hard plaque you have, soft plaque, and then there is value to repeating, as we did here, to show not only were the numbers good, all the numbers were in the green, if you will, the gauge in the green, but more importantly, and most importantly, we have the plaque on the run, right? If you repeat a calcium score, particularly if you do a great job, right, all the right tools, diet, exercise, medication, whatever, you will see the calcium score go up. And then people really panic because they're saying, I'm taking medications, I'm exercising, I lost 30 pounds, I did all the right stuff, I quit smoking, and my calcium scoring is going up. Because the problem is you're looking at the wrong number.
Be aware of your actions because your actions become habit. And as long as you're aware of what
Well
you're
put.
doing.
I want to thank you. If you have any concerns at all, have any questions, feel free to comment. Click this like and subscribe button here on our YouTube channel. It helps us a lot, get the word out. Reach out to us at clearcardio.com and schedule your session with Dr. Osborne and the ClearCardio team and let us look under the hood.